I'm the nurse injector here at Allure. I have been a nurse for 18 years. I've been injecting for over 13. And Botox is one of the neurotoxins that really help do a lot of different things for our face, for a lot of different body parts, all kinds of stuff.
Absolutely.
So, starting from the beginning, there's a few different neurotoxins. You've probably heard of them: Jeuveau, Daxi, Xeomin, Dysport, and Botox, and they're all very similar. They work in a very similar way. Um, it's basically a paralytic medication that's injected into the muscle, so the muscle does not get the response from the nerve to move, to contract. So the way that this works is that if we inject the muscles that are contracting, the muscles contract and they build up the skin, they push the skin together and they make a wrinkle. So the wrinkle is an injury in the skin, and by treating what's actually causing the wrinkle, we can help treat the wrinkle with other things. Skincare, microneedling, lasers. Sometimes if the line is not very deep at all, a couple times of Botox, uh, any kind of neurotoxin, then the line dissipates on its own. So just depends if you're one of those lucky people.
I'm not sure if I'm lucky.
It has a lot to do with how well we take care of our skin and genetics and how hydrated we are. Kind of how fast we get that cell turnover to get to the bottom of the wrinkle.
Hydration is very important.
It really is. So starting there, neurotoxin, it takes anywhere from 5 to 14 days to take effect, depending on which brand that you use. So once you get injected, you want to think about if you have anything to do for the next 2 weeks. So you don't want to do this, the day before an event or anything like that. It lasts about 3 to 4 months. Daxi is a different one. It lasts a little bit longer. That's more new to the market. But it lasts about 3 to 4 months. The cool thing about all of this is it's very customizable. You can be completely frozen if you want. It can be like, oh, I just kind of don't like this one little part and I just want it to be softer. I think the main thing that I hear is people say when they're new to aesthetics is, I don't want to look different. I don't want anybody to know.
Because people always feel like that you'll be like a smile face
right,
or something like that.
Right. Yeah. And that is the best part about it, is when you have been doing it for a long time, it's really easy to kind of customize to what people want. This really bothers me, but I don't really mind about this. But it's also about balancing someone's face, to make the whole thing look like we're all on the same, age. Where else? So we said how long it lasts.
Yeah.
And then I think we can talk about the different areas that we do, maybe the most common ones.
So when a person comes in, and you're consulting them, and say for instance I come and say, okay, I've heard so much about Botox, I think I want to do it. What do you suggest for me? So what would you tell me to do?
Well, I first always ask, I hold the mirror right up to your face, and I say, what bothers you the most? When you look in the mirror, what are you seeing? What are you feeling? Like, why did you, make the phone call and come into the appointment? So I would ask you, what is it that bothers you the most? And that's kind of where I start.
You start. Okay.
Yeah.
So I would say probably in here.
Okay.
And then maybe like I'm an older lady. And so how you're younger and you never want what do they call them, crow's feet?
Yes.
Right here?
Yes.
Yeah. So I think maybe here and in here. Do you do anything for the jowl area?
Yes.
See? Yeah, that.
Neurotoxin is a really cool thing that, as I have been injecting over the last decade, it's gotten way more popular, and it's really great because it's a wonderful way to balance the face so that the top of our face doesn't look smooth and flawless, and the bottom of our face starts to look like it's not the same person. Like one of those books with the different.
Yes.
So there's so many different things that toxin can do to fix not just wrinkles. So the way it works is when a muscle contracts, the neurotoxin relaxes it. So if the muscle comes in and together, you're going to see a line form perpendicularly to where the muscles come. And when you relax it, the muscles are going to go out and up. a little bit, okay? So if the muscle pulls down and you're gonna relax it, then it's gonna go up. If the muscle pulls up and you relax it, then it's gonna come down. So finding an injector at a place that you feel comfortable, that's gonna know how to watch your face and how you move your face is really important. What Lanita would get is not the same thing that I would get, is not the same thing that, you know, Kathy would get, or even Dr. Terry. It's all different because everybody has, you know, different strengths of muscles, and everybody can't tolerate the same doses in the same place, because then, you know, it could create adverse effects. So back to this, we were talking about your beautiful face. Go ahead and look this way for me, okay? Now make your angry face. This, can you do this one? Yeah. Think about something like maybe your spouse.
If you're watching, babe, like
I didn't mean that. I literally just picked something. Your kids. Okay. I don't know. So when we have this line here, okay, we have a muscle that comes through here. We have one that pulls down and one that goes over here. Go ahead and relax. Okay. So what we would do, she has a very faint etching line here, is if we were going to treat the 11 lines, right, we would treat these muscles here and these muscles here. And that would be about 5 little pokes, okay? And anywhere in this area, this can be anywhere from like 18 units all the way up to like 35 units. So it just depends on how strong these muscles are on every person. But I wanted to give an idea of the unit amounts, because I think that's a very frequent question, is people are like, okay, it's X amount of dollars per units, but how many units am I gonna need? So this area, I would say, if you're like mentally estimating a budget, a good-ish is in the 20s, right? So hers is very, very light. She doesn't have a ton of contraction, and she only has a faint line. So she would not get a large dose in this area at all. Now, I don't know if you've noticed, but as we've been talking, she's lifted her eyes here several times. So, unfortunately, even though this is her main concern, we couldn't hit this muscle with a ton of toxin, because then it would make her eyes heavy. And we don't want to do anything that's going to bring these eyebrows down, because she's already naturally opening them and lifting them, which is something that we just happens as we get older, and we're not old, but as we get older, we lift, right? So like we want to see better, and it's just our body does it without thinking, right? So we would do something light across the forehead, and then maybe just a tiny bit here. And then what I would suggest is, if you will move your glasses for me, thank you. What I would suggest is, because she's lifting here on this outside, and because she did talk about the crow's feet, but even if she didn't, I would suggest doing some in this area. And again, she has beautiful skin, there's not a line here. But that's the cool thing about toxin is I see a lot. Prevention. Yes, I see a lot of younger clientele than I ever have before, because we're kind of getting in on the idea that like if we treat it before it starts, then we don't have to fix it
when it happens.
Exactly.
Also, the first time I ever heard about it was my cousin with migraines, that she was getting Botox for migraines, and I was like, what?
Yes. So they do that clinically, like most insurances covers it, and they inject it in a lot of the same spots that we're talking about now, and then they actually go up into the scalp and down here and in the traps. And in the traps is actually another more popular area for toxin now, for people who have like a lot of stress, who don't need to do the whole headaches, but they'll come in and just do trap Botox or trap toxin. And then also it kind of slims the neckline. So if you're somebody that has, naturally just a larger trap area because of maybe your posture or, what you do for work or anything like that. So I would suggest doing the eyes, just to finish this. I would suggest doing some around the eyes. Not too much, but enough to kind of just open the outer canthus and give your outer eyebrow, just a tiny bit of lift.
Okay.
So that is kind of what she was talking about with the migraines, because a lot of times when we get migraines, we're squinting, we're furrowing our brow, so relaxing those muscles can actually alleviate headaches. I have a lot of clients who get it not just for wrinkles, but an added bonus of not having those like tension headaches when they get really tired, and it's just kind of been one of those days. Yes. Moving down the face,
Yes.
I'm just going to talk about the different areas that we can treat because you talked about,
the jowls.
yes. So a cool thing that you can do with toxin is a lip flip. So maybe you're on the fence about lip filler.
I was born with these.
They're very beautiful. So a lip flip or doing toxin in the lip is to help those little
Yes.
smoker lines. Even if you're not a smoker, a lot of people with big wide smiles, have big wide mouths, and then anytime you make a pucker face to say certain words, you start to get these lines because over time that skin kind of thins. So it's a couple units in the upper lip, and that can help flip it up just ever so slightly.
Oh, nice.
We can also put some here in these muscles right here to kind of drop that lip down if you're a person with a really gummy smile. So if you have a really big smile and it shows the top of your teeth and some gums, we can bring it down to kind of make more of that lip be seen. And then when we're talking about the gels, go ahead and do a face where you can show me your bottom teeth. Yes. Okay. So these here are the DAOs, and then kind of do like a Hulk face, like, can you pop these out? You also get to go to acting class when you come see me, okay?
Right.
So when we have her pull down, the muscle pulls down, and if you remember in the beginning, we talked about injecting the muscle, and what is it going to do? It's going to make it do the opposite.
Right.
So if we inject the DAOs, it can actually help lift the corners of the mouth. We can inject down here where the DAO attaches, and then some of the platysmal bands. And that actually, because it pulls down and out, when you inject it, it's going to go up and back to give you a little bit more.
Like a lift.
Yes, a little bit. A little bit. Also, the chin is a really good area that we do. Probably one of my favorites, I think. I've been doing it long enough to it's not a very crazy noticeable one, like you get the 11s, they smooth out, it's totally gratifying and awesome. But it's great when you're trying to balance someone's face and the chin muscle comes up, and it's not something we even recognize that's happening. But as we get older, the chin starts to come up and our nose starts to come down. So when we inject the chin and it kind of drops it, it gives us this nice elongated point. And sometimes we don't even need to do filler in the chin if we can get it to relax a little bit.
Absolutely. I'm so excited. I wish this was a live demonstration. Please let me know. I've always thought about it, but as you get older, you're like, oh, maybe you should do something. And then they always say, let me just say black don't crack. It does a little. It does. Sorry. But I'm excited. I'm super excited to get some. We do have some pictures of what it would look like.
I don't know if that can
for Instagram, Facebook, you guys can see them on the screen. But these are some before and after.
Look at that pretty face. So see how after 2 weeks, and I think yes, this is Botox. So 2 weeks, those middle muscles here, you can actually see the head of the muscle, and now she's frowning in this face, and you don't have it. You didn't have any really tons of wrinkles before, but it looks really good.
It does.
How it softened it and brought it up.
And then this next one.
Let's see. Oh, this is a great one to show of kind of the crow's feet. So that really softened and kind of opened it up, and it doesn't look totally different. So it makes it very subtle, and it took away almost 90% of that
Especially
scrunching.
The scrunching, yep. Oh, it did. That's good.
All right, what else do we have here? This is another angry one. Angry, and then not angry. And I think this is kind of what I was talking about in the beginning.
Oh, the line.
So her line is fairly deep, right? And so in 2 weeks, it's much softer, right? But we have to be able to heal that wrinkle, which is an injury in the skin. And that's when you're going to hit it with your retinols and
retinol is like a skin treatment, right?
Yes.
Like that you can do at home.
Yes.
Okay.
So anytime you're doing any kind of toxin, filler, anything, you really want to make sure you're doing some kind of added medical skin care, medical grade skin care, because neurotoxin is a pretty big investment, and that you want to prolong that investment even longer. So you want to take care of the skin on top, because if you're relaxing the muscle on the bottom, but you don't address the skin on top, then you're only treating, part of the problem. I have a tip. I recently went down a rabbit hole of a study done to make your neurotoxin last longer. And 4 days before you, 4 days before your toxin appointment, thank you, you want to take 25 to 40 milligrams of zinc twice a day.
Oh, yeah. So I do that every day.
Do you?
I do zinc every
it's
day.
Probably going to last way longer on you.
So okay, for instance, I'm going out of town next weekend.
Mm-hmm.
Should I get, if I was going to get injections, should I get them now or should I wait till I come back?
I would like to say, in a perfect world, I would like you to wait 2 weeks so that if anything settles, interestingly that you don't like, because, people's muscles react differently.
Absolutely.
So I would, like I said, in a perfect world, it would be great if you could stay, if you were around for 2 weeks, and then in 2 weeks I like to see people back, especially first time people who've never had it before, and then we can address, I liked this, I didn't like this, and then I always have people take note of, when their movement, really started to come back full force, because in a lot of these places, dose equals duration. So while it's very customizable, we want to start off kind of slow so that, you get used to it, you see if you like it, you're not stuck with it forever, and then we can go up on the dose the next time, so it's not like a giant commitment.
I'm excited. Well, did you guys learn as much as I did today about neurotoxin injections? If you have any questions, we can answer them now. Oh, how often should I get a treatment?
So that kind of goes back to what we just talked about how long it's going to last. It's also, again, customizable. So if your goal is to, you don't have a line.
I want to look 30.
Why? You look good now.
Okay. Thank you.
So
she doesn't get paid to say that.
I don't. So how often can I get the treatments? I would say as soon as your movement starts to come back full force, because neurotoxin kind of goes up into a peak and then it slowly comes down. So you do start to get some of that movement back after about 6-ish, 8-ish weeks, right? And it's just gonna slowly come back. So I don't need you to come back immediately when you start to get movement, but at about that 3-month mark, if we've gone a more conservative dose, I want you to come back. Right? Otherwise, I have clients, some that come every 6 months, because we've gotten to a place where we've got the dose kind of perfected, and they want more of a softening. I have clients who run marathons and come every 2 months because it's gone. They metabolize it faster. Men, my male clients usually metabolize it a little bit faster too.
And that's great you said that. So men are actually favorable to do Botox as well.
Yes. Although, like in this Midwest, we pretend like, we don't get anything done. We just totally look like this all the time. It is a very common practice to have men and women come in anywhere from 20 to 85, I think is my oldest client. So it's really open to just about anyone who's looking for like a zhuzh, right?
A pickup.
Doesn't have to be like a full frozen face at all. You can do a little bit.
Well, I need a little zhuzh. What should I do prior to and after a treatment?
So we talked about the zinc. 4 days before, up through the day of your treatment, and that's supposed to make it last way longer. And then no drinking alcohol before. I want you to work out before your appointment, not after.
Because you can't do anything for like 4 hours, right?
Yes. So if you get your glabella and corrugators injected here, right? If these muscles get injected here, I don't want you to do any horizontal activities for 4 to 6 hours. I don't want you to go massage your face when you get home. I want the medication to stay right in the muscle where I put it. If it goes, if we massage it, if we do some extra crazy workouts, we don't want that medication to drift into the elevator muscle that opens our eye. That's the ptosis that everybody talks about when they get Botox. And it can happen, even to the best injectors. Some people have different anatomy, some things are it's just fluke. But with safe injecting and, kind of for about 4 hours, not massaging the area and not
Just
going to
letting
get
it
a
be.
massage afterwards, being face down, you'll be totally fine.
Does it hurt?
No, it doesn't. I would say no, not at all. I giggle because we have some needle phobic people in this office. It is a tiny poke. I use insulin syringes that are 31 gauge. So, and there's not a ton of pokes. And, we distract you. We have a lot of fun here.
I actually was able to sit in on some, and so because I was very intrigued to know what it was like. It was super and quick. I was
yes,
like, "Well, you're done?"
It's a quick appointment.
Yeah.
No, I mean, and if you're really, really uncomfortable, there are a handful of patients that I will give you a little bit of numbing cream for, or maybe like pre-treat with a little bit of ice. But it really, you can do it. It's okay. But we'll make you comfortable.